I'm doing well, thank you.
Okay, today we're going to be at face mapping and scalp revision. Do you have any concerns do you want to share with me before we get started?
Yeah, I've just been having some breakouts, might be from like stress, I'm not sure. And then a little bit of itching in my scalp, I've noticed.
Okay. Did you notice if it started recently or has it been like on and off?
It's kind of on and off. It's just been bothering me more lately, but it's happened before.
Okay. Did something change in your life recently that maybe could be making you stress a little bit more than usual?
I am planning a wedding.
Wow, okay.
So that's been a lot.
Yeah, that is definitely some very stressful time. So, okay. Do you have any allergies that I should be aware of?
No.
Okay. Are you allergic to latex?
No.
Sure. Okay. Okay, very good. Any medication that you take regularly?
Just some vitamins, vitamin D. Yeah.
Okay. And can you tell me a little bit about your skin care routine?
I don't do too much. I just try and wash my face with unscented Dove soap morning and night, and I use an oil-free moisturizer and an SPF as well.
Okay. Do you usually wear makeup?
Only, for work, so I won't do it. I'll probably wear makeup like two times a week.
Okay. And do you always remove your makeup before going to sleep?
Yes, I do.
Okay. Okay, I'm going to get started with your scalp. Putting my gloves on for this part. Just don't want to transfer any of the oil, natural oil in my hands. Okay, I'm basically gonna be parting your hair and looking at each of those sections individually. I'm gonna be using a magnifying glass to make sure that I look closely at the skin. If there's any discomfort at any point, please let me know. If there are any spots that are especially itchy,
Okay.
please let me know as well. Where do you usually part your hair?
Down the middle.
Okay, I'm gonna start to look at this area first. Okay. Scalp looks a little bit oily. Not too much though. There's no redness or sun damage in this area, which is usually what gets more exposure to the sun. So that's really good. Would you say the itchiness is kind of all over or certain parts?
Yeah, it's sort of just all over.
Do you notice that it gets worse at certain times of the day or when you're doing certain activities?
I feel like it definitely feels a little worse. Like just when I'm feeling kind of anxious or stressed, I'll notice.
Yeah. Can you have you turn your head this way? Okay. There's a little bit of irritation, especially more so along the hairline. And then it gets better. As we move away, but there's definitely some scaly patches, dry. Okay. Some breakouts along the hairline, but not really as we get farther from your face. Okay, you can go ahead and turn this way. A bit of irritation, inflammation here. Okay. What kind of shampoo do you use?
I use like a charcoal-based shampoo.
Okay. Do you use any hair treatments or hair products?
I do like a leave-in conditioner, couple, like every month, once a month.
Okay. Go ahead and turn your head a little bit more this way. Okay, some breakouts in this area too. Some inflammation. Okay. Take a look here towards the back of your head. Okay. Yeah, there's a little bit of irritation on that side as well. It's very common to find that this area gets a little bit more irritated because just how we sweat naturally. Okay. Okay, what I'm gonna do today with your scalp, it's definitely not too bad, but there is some dryness, scale patches, and a few breakouts and a little bit of irritation. So I'm going to be applying a serum.
Sounds good, thank you.
Okay, after I apply the serum, I would like for you to keep it on for at least 24 hours before you wash your hair. Okay, so I hope you don't have any big plans today.
No, just hang.
It is gonna look a little bit oily.
It's okay.
Okay, I'm going to be applying it with a cotton swab. Go ahead and turn it this way for you. Just saturating it. Serum, and we're going to pay special attention to the area closer to your hairline where I notice some more breakouts than the rest of the scalp. It's very concentrated, so we don't need a big amount of it. Okay, just look to the other side really quick. I'm doing the back of the head. Okay, just gonna massage that in, making sure we distribute it on your scalp. Go ahead and try to lift your head up a little bit. Just gonna, you can rest your head on my hands. Okay. And while I'm massaging the serum into your scalp, I'm also promoting blood flow in your scalp. Okay, so I'm going to let this sit in. And I'm moving on to your face. Just going to be changing my gloves. Want to make sure I don't transfer any of that serum or oils. Okay, I'm just changing my gloves. Okay, are you still comfortable?
Yes, thank you.
Okay. Start taking a general look first before we get into the detailed examination. Just looking for which are the most affected areas. I do notice a few breakouts on your face, especially the area around your mouth and your chin. A little bit about the eyebrows, pretty minimal. And this over here is a monk, right?
Mm-hmm.
Have you had that as long as you can remember?
Yeah, my whole life.
No changes recently? Okay. Be feeling for any inflammation. If there's anything that bothers you or feel like increased sensitivity in a certain area, please let me know.
It's just like a little bit on the breakouts themselves.
Okay. Okay. I'm going to start at your forehead. Okay. The forehead is indicative of the health in our bladder and small intestines. So we're looking at the part right in the middle of your forehead and sides as well. The skin is a little bit more on the oily side, which is very normal. Most people generate a lot more oil and T-zones, so around this area. But it doesn't seem that you have any clogged pores, and definitely no breakouts in this area. Okay. And this area between your eyes. It's pretty healthy. No irritation or inflammation, so that's indication of a healthy liver. Do you drink any alcohol?
No, I don't.
Okay. Yeah, I can definitely tell you're healthy as very healthy. Okay. We're looking at the area right above your eyebrows. Okay. And over here. don't see any breakouts on this area. Just taking a closer look. Looks like there are some acne marks, but not really breakouts. And above your eyebrows, even though I notice a little bit more oil production in the area, there are no breakouts or irritation. Skin looks healthy. Okay, so this means your heart is working properly. No issues there. I'm going to be moving on to your upper cheeks and towards the ears. This area is usually an indication of your kidneys, but there are no issues. Okay, way down towards the mouth, that's where I start to notice some breakouts. There are definitely along the sides of the mouth. And it seems that this might be a recurring problem just because I can notice also some past acne marks, as well as some new breakouts. So this gives an idea of the health of your large intestines and all of the most common causes for issues with your large intestine. Could be seasonal allergies. Do you ever experience any?
Yeah, I do. I get them really badly.
Okay, so that just means that your body is working a lot harder to get rid of any toxins, any environmental allergens, which is causing some stress to your large intestines. Okay. And I notice the same problem along the chin. Just increased oil production, quite a few breakouts in this area. And to be honest, I'm not surprised at all, given that you are planning a wedding, and that is a lot of stress, which is causing a hormonal imbalance. What kind of coping mechanisms do you use to deal with the stress? Do you work out?
Yeah, I've been working out, doing yoga and swimming, and just taking a lot of walks.
Okay, so yeah, definitely keep doing that. I would also recommend trying some meditation. Okay, I'm going to be taking a few measurements. Just making sure that there is symmetry in your face. Okay. Okay, we have 3 inches. side. Okay. So definitely your face is very well proportioned, and the symmetry is okay. You can go ahead and open your eyes for me. Measuring distance between your pupils. Okay, and go ahead and relax. Okay, nose proportions compared to the distance between your eyes is good. Okay, that's 9 inches. 6.5. 6.5. 6.5. 6.5. Portions. Okay. Okay, Hannah, your face does look very symmetrical. Proportion-wise, it's very well proportioned. Other than those spots along your chin and your mouth, I don't notice any major concerns with your face and your overall health. I do want to apply some point pressure therapy. We want to make sure that we release that blockage of energy that is causing some of the hormonal imbalance and also caused by the stress from the seasonal allergies on your body. Okay? Okay, just go ahead and relax. This is not going to hurt. Okay, I'm going to be applying some pressure, very localized in certain areas. Should be feeling some pressure, but not really pain. this pressure point right in the middle of our eyes is one of the main pressure points that help rebalance our energy. Okay. Do you feel this?
Yes, I do.
How about this?
Mm-hmm. Yes. 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 Yes.
Okay. Would you say it feels the same amount of pressure on both sides?
Yeah, it does the same.
How about now?
Mm-hmm.
No.
Same. Same.
Okay. Does it feel the same temperature on both sides?
Yes, it does.
How about now?
Same.
Okay, very good. Okay, Hannah, we are done with today's treatment. I do recommend that you keep on working out, maybe try out some meditation. Planning a wedding is very, very stressful,
Yes,
so just try to stay calm and everything's going to be great.
Thank you so much.
Congratulations again on your engagement, and I hope I see you soon.
Thank you.
I'm going to be tying your hair up a little bit just so we have access to take a look at your back. Is that comfortable?
Yes.
Make sure it doesn't fall. So, just walk me through the symptoms that you've been having on your neck.
I've just been feeling a little tight around my trap area.
Okay.
Just a lot of tension and tightness.
Okay. Have you been doing anything out of the ordinary, working out, maybe a new exercise?
Nothing out of the ordinary. I've just been adding a little more weight to when I'm lifting, so maybe that could be it.
Okay. How would you describe the pain? Is it a dull pain, sharp?
Pretty sharp.
Okay, so sharp on both sides?
Yes.
Okay. Okay. I'm going to be taking a look at your back, your spine, the alignment. We're going to do a few movements and assess your spine mobility. And then we'll see what kind of treatment we can carry out. just a tiny bit of inflammation. Right around C5. Some tension. Like you mentioned on your traps, they feel pretty tight. How often do you lift weights?
Maybe like 3 to 4 times a week.
Okay. Do you tend to alternate the muscles that you're working? Do you give them enough time to recover?
Yes.
Okay.
I try.
Okay. I'm trying to feel inflammation alongside the spine. How's your form when you lift? Are you pretty good at?
Yeah, I try to keep my posture really straight. Just be aware of how I'm lifting.
One of the most important things that we often forget about when we're lifting heavy weights is to keep the core engaged, because that really helps support the spine.
Okay.
So just be very mindful of that when you're lifting. Just looking for inflammation on your shoulders, your scapula. So I definitely feel a little bit more inflammation on your right side. Checking for normal changes of temperature. Do my hands feel the same temperature to you as I slide them down?
Yes, they do.
Do they feel the same on either side of the spine? Okay. How about now?
Yes.
How about now? How about now?
Yes.
Okay, that's really good. Okay, so now I'm going to ask you to do a few movements for me. I just want to assess the mobility of your spine.
Okay.
Can you go ahead and try to touch your right shoulder with your right ear? Okay. Just checking for any overextension of the muscle. Is there any pain here?
Yes.
Yeah. Okay. Let's do the other side. Is there a pain over here? Okay. Yeah, it's definitely a little bit tight. Go ahead and stay neutral. So that pain that you felt on your shoulders, how would you rate it from 0 to 10?
Maybe like 4 or 5.
Okay.
When it's present.
Does it hurt as much now, or it was a lot more when you were doing those movements?
Just as the days go by, it gets a little worse and worse each time.
Oh, okay. Does it hurt more if I press on it, or it's the same?
It was more when I was putting my head to one side where I could really feel it more.
Okay. Okay. Can you go ahead and try to touch your chin to your chest? Okay. Any pain right here?
Actually, no.
No. Okay. Go ahead and now try to look up. Any pain right here?
No.
Okay. Go ahead and stay neutral. Okay, I'm going to be assessing your jaw. Any tension right here? Is there any pain as I'm pressing?
Yes, a little bit.
On both sides?
Mhm.
Okay.
I do clench my teeth while I sleep.
Okay. Yeah, there's definitely a little bit of tension right there. Does it hurt as I go down towards your... No.
It was high.
Okay. Okay, can you go ahead and look towards me? Okay. Okay, now look to the other side. Okay. A little bit of tension right there as well. Okay. Okay, I'm going to be tapping lightly on along your spine. Just let me know if you feel any pinching. Maybe you might feel like sharp pain, or it could be some tingling. Anything that feels out of the ordinary, just please let me know. Nothing?
No, it was more when it was higher, when I felt a little sharpness.
Okay. So nothing down here. Okay. Does any of these feel worse than the other?
Mm-hmm.
Here?
Yes.
How about here?
Mm-hmm. Yeah, that vicinity right there.
Right here. Okay. Let me know when it stops.
Mm-hmm.
actually 13. Okay, so it's the top 13 centimeters of your spine that seem to be affected. Take a few measurements here. Right at the most prominent part of the shoulder. Go across. Right here. So 14.5 inches. Okay, 7.25. So that's perfectly symmetrical. That's great. Just gonna grab a marker. I wanna make a few marks on your back to take a couple more measurements. I'll be locating a few important points on your back. So we've got the center of C5 right here. Okay. Okay. Looking for the highest point of your scapula. Can you actually go ahead and try to touch the middle of your back with your left hand on from the bottom? Right there. Just so I can easily trace this. Right here. Okay. Now we'll do the other side. Here. Go ahead and feel a little deviation of the spine towards the lower. You go ahead and try to touch your chin to your chest. Okay, you can return to neutral position. not too pronounced, so I'm not really concerned about it. Following your spine. Making sure that the spaces between your vertebrae are even. There's no pinching or deviation of the vertebrae. A little bit of misalignment on this side of your back, which could be because this is so tense and it's just pulling up. But it's perfectly midline, so that's great. Okay, Emily, we're gonna start with some massage just along these muscles right here. I'm gonna try to loosen up the knots that are causing so much tightness and pain.
Okay, thank you.
So I'm gonna start with just some mild pressure, and you can just give me feedback as we go and we can adjust. Okay. I'm going to be using this anti-inflammatory oil. It's going to help us reduce that inflammation.
Okay.
It smells really good too.
Yeah, it does.
Okay, I'm going to come and wash up. And I'll be right back. Yeah, I can feel the fibers on the muscles.
Mm-hmm. Feels good.
Okay, I'm going to go pretty mild, and if you would like for me to increase the pressure, let me know. There's a tiny bit of redness after the session. That's normal, but it should go away within an hour. Start going down alongside the scapula. Yeah, your right side's a little bit worse.
Yeah, I could feel that now.
Yeah, it's a little bit tighter right here. Gonna be applying some pressure. Just starting the neck going down the shoulders. Okay, I'm going to be using this massage gun on the lowest setting. You feel a little bit funny at first, but
It's great.
if it's too much, please let me know. I already feel this area a lot looser. So that's great. Okay. I'm gonna go ahead and do some mild adjustments. We're just gonna be doing a few movements with your head. I'm gonna be changing my gloves so I don't put any oil on your face. Okay, so I'm just gonna ask you to let your neck loose. I'm just gonna be doing a few movements, okay? Okay, here I'm just applying a bit of traction, trying to elongate. Okay. Just gonna tie your hair back. It's falling. Okay. Okay. Do a few adjustments here. Any pain right there? Okay. Okay. Now I'm gonna be adjusting a little bit on your jaw to help you with the clenching, the pain. Okay. Okay, so we're gonna be adjusting the jaw. Can you go ahead and let it a little bit loose, kind of like half open? There you go. Okay. Okay, go ahead and take a deep breath right there. Exhale. Okay. Okay, one more time, deep breath. Okay, go ahead and let it loose. Now try to move your jaw to the right side. Okay, that's perfect. Now to the other side. Okay. Okay, go ahead, back to neutral. Perfect. Now, imagine that someone's pulling you from a string from this point on your head. Go ahead and try to straighten your spine as much as possible. Pulling up. Okay, great. Now go ahead and relax. Okay, so we're applying a little bit of traction right there. That's great. You can go ahead and raise your arm to the front all the way as far up as you can. Definitely feel your shoulder muscle. It's very defined, probably from your workouts, so that's great. And any pain right here, just
tiniest bit.
Okay, go ahead and lower this. Now we're gonna do these. The left shoulder, go ahead and raise the arm. Okay, how about any pain over here?
Not so much on this side.
Okay, go ahead and lay. Okay, Emily, this should really help your shoulders feel better. I would go a little bit easy on the weightlifting, at least for any upper muscle, so you can focus more on legs, your core, and just give it a week,
Sure.
and then you should be good to go. Okay?
All right, thank you.
Do you have any questions?
I could still stretch.
Yes, a lot of stretching that would do wonders for your back, your neck. Okay.
Thank you, Ivy.
Yeah, no problem. I'm gonna get started by inspecting the scalp. You can actually just go ahead and relax. I'm gonna be working on your head. Okay, first I'm just gonna be inspecting with a light. Okay, I'm gonna be brushing a little bit. Okay, there's a tiny bit of dandruff and it's pretty minimal. Do you have any hair products on your hair currently?
I have no products, no.
Okay. How often do you wash your hair?
Once every 2 days.
Okay. Okay, the skin, oh, sorry. The skin around the hairline looks very healthy. Okay, I don't really notice any inflammation. So I'm going to be looking a little bit more in detail. Be parting the hair in a few different sections.
But ask it to turn your face this way.
Okay. Okay, I'm finding a few different spots that are a little bit red. Looks like the follicle is a little bit inflamed. Have you used any new products lately?
I have been using a new serum on my hair.
Is that like a hydrating serum, a growth serum?
Yeah, a growth and hydrating serum.
Okay, I'm just gonna go in and try to loosen up some of those little scaly, those skin cells on your scalp. removing all the loose little skin cells from the scalp, and then we're going to be doing a treatment. Is it itching or hurting at all?
Maybe a little itchy, but no pain.
Okay. I'm going to be taking a sample of loose skin from your scalp. We just want to rule out any skin conditions other than just some dryness.
Okay.
Before I go ahead and do the hydrating treatment, I want to do a sensations test. Since you did mention you've been feeling a little bit of tingling, just want to make sure that's nothing neurological. Okay. I'm going to be using a couple tools. One is going to feel sharp, one is going to feel dull. This is sharp, just just to demonstrate that. And this one is dull. Can you tell the difference?
Yes.
Yeah.
Sharp. Dull.
Okay, go ahead and turn your face a little bit.
Sharp. Dull. 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 Sharp. Sharp. Sharp.
Okay, I'm going to move to another spot.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Do you feel this?
Up. Dull.
Okay.
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay, gonna move on to the other side.
Sharp. Sharp. Dull.
Okay.
Dull. Dull. Sharp. Dull.
Okay. Okay.
Dull. Sharp. 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 Dull. Sharp.
Okay. Oops. Sorry. Okay, go ahead and turn your face a tiny bit this way.
Sharp. Dull. 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 Sharp. Sharp.
Okay. So now I'm going to be using two objects that are the same, and I'm going to be applying some pressure. So I want you to tell me if you feel either one, so this would be one, or two pressure points. So you can just say one or two.
Okay. 1, 2, 1, 2, 2, 2, 2, 2, 2, 1, 1, 1, 1, 2.
Okay. Okay, now I'm going to be gently tapping on your scalp. I'm going to be tapping either 1, 2, or 3 consecutive times. Just let me know if you feel 1, 2, or 3.
1, 2, 2, 2, 1, 3, 2, 1, 2,
Okay, good. Just move your head a tiny bit.
1, 2, 3, 2, 1, 3.
Okay. Okay, now I'm going to go ahead and brush the hair before we go ahead and apply some treatment on your scalp. Okay, I'm going to be applying a treatment on your scalp. It's a foaming treatment. I'm going to be dividing the hair in a few different sections. Go ahead and turn it this way. Do you usually part your hair in the middle?
Yes.
Okay, we'll focus a little bit on this area, which is really the part that receives more sun damage. And it's most exposed to the elements. Okay. Okay. Go ahead and massage that in. Okay, I'm gonna go ahead and turn you around, and I'm gonna be doing a little bit of scalp massage. So even though we're focusing more on the scalp, I do want to apply some hydrating oil to the roots as well, to the ends. Sorry. And this is just hydrating hair oil. Applying that to my hands. Okay, I'm gonna go ahead and massage the scalp a little bit. And make sure that the product we applied gets absorbed. I'm gonna be massaging with this cold glass gloves. It's just gonna help us make sure that everything gets absorbed. I'm going to be doing a little bit of hair pulling therapy. This shouldn't really hurt. You might feel a little bit of pressure, but if it hurts, please let me know. Hi, Niso. How are you?
Hi, I'm good. How are you?
I'm good. So why don't you tell me a little bit about what happened? I read on your chart that you had a little bit of an accident.
Yeah, I went to a yoga class.
Okay.
And I was trying to do a pose that I haven't done in a long time, and I fell and hit my head.
Okay.
And now I just feel a little sore and tender, and just I've been getting some headaches even. So I just wanted to check out what's going on.
Any numbness?
Yeah, I've been feeling a little numb on my scalp.
Okay. Okay, so I'm just gonna make note of that. So you hit your head. When was this?
This was about 3 days ago.
3 days. When you fell, where on your head did you hit it? Was that kind of like on the back?
Yeah,
or
it's like the top and the back.
were you trying to do a headstand or something?
Okay. I was.
Okay. Any other symptoms that you've noticed? Any nausea, dizziness?
If I get up too fast, I do get a little headache and nauseous.
Okay. Okay. And did you fall because you lost your balance, or did you feel dizzy or sick and you fell?
No, it was just loss of balance.
Okay. Just want to make sure there's no underlying cause for your fall. Okay. So I'm going to do a few tests. I want to make sure that there's no damage to the cranial nerves since you did hit your head. And then I'll inspect your scalp to make sure that there's nothing there causing that numbness. Okay?
Sounds good.
Okay, I'm just going to sanitize my hands. Okay, I'm going to start with a vision test. First, I'll take a look at your pupils. Okay. Just want to make sure that they're reactive to light. Okay. Go ahead and follow my fingers with your eyes. Just don't move your head, just the eyes. Okay, did that feel difficult at all?
No.
No, okay. Just gonna be palpating your face. Okay, go ahead and give me a big smile. Palpate here. I'm just checking the muscle tone. Make sure there's no wasting. Okay, can you give me a bigger smile? Just showing your teeth and all. Perfect. Okay, so muscle tone seems to be pretty good. Go ahead and frown for me. Okay. Here, raise your eyebrows. Okay, so try to keep them raised. I'm going to try to press down on them. Okay. Now I'm going to press down and try to raise your eyebrows. Okay, very good. Okay, so no issues there, that's good. Just gonna check your reflex right there. If I tap it here, does this hurt? Okay, very good. Okay, so definitely your face, all your muscles are not compromised, so that is a good sign. It's normal. Okay, so I'm gonna do a sensations test, making sure that the nerves that perceive sensations on your face are also intact. Go ahead and close your eyes. Does this feel cold?
Yeah.
Can you tell me where you feel it on your face?
On my cheek. Cheek. Forehead. Chin. Chest. Forehead. Chin. Nose. Chin. Chin. Jaw. Cheek. Cheek. Forehead. Neck. Neck.
Okay, very good. Now can you tell me if this feels cold or dull?
Cold. Dull. 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 Cold. 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 Dull. 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 Cold. Cold. Dull. Dull. Cold. Cold. Cold.
Okay. Now can you tell me if this feels sharp or dull?
Sharp. 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 Dull. 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 Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Okay, perfect. So definitely, sensations on your face are being received properly by your brain. So that is very good. I'm gonna go ahead and do a vision test. Can you just hold that in front of you? Do you wear contacts or glasses?
I do. I wear contacts on my left eye.
Okay. Do you need contacts on the right one, or you just don't need them?
I don't wear them, and I don't need them.
Okay. Can you go ahead and cover your right eye for me? How does that look? Can you read all the letters?
Yeah.
Can you tell me what color is this?
It's red.
And this one?
Green.
Do you see this number right here?
9.
And this one right here?
7.
Can you tell me which circle is bigger?
9.
Okay, can you tell me what letter is this one?
T.
This one?
O.
This one?
C.
This one?
F.
Okay, can we switch eyes? Can you tell me what color this is?
Red.
And this one?
Green.
What letter is this?
I can't tell.
Okay. Does that help at all?
No.
Okay. Okay. Okay, we're going to do a color deficiency test.
Okay.
Are you able to tell me what number is this one?
8.
And this one right here?
29.
How about this one?
3. 15.
Okay. This one right here?
23.
This one?
There's nothing there.
Okay. How about here?
No numbers.
Here?
Same thing.
This one?
26. 42.
This one here?
96.
Are you able to follow the line from this X to this X, following the color line? You can trace it with your fingers. Okay, very good. And try this one here. I'll do this one here as well. Okay, perfect. So definitely color vision is normal. How many fingers do you see up right now?
4.
Are you able to focus on my nose? Can you see my fingers in your peripheral vision?
Yes.
Can you tell how many I'm holding up on each hand?
1.
Okay. How about now?
2.
How about now?
1 on this side, 2 on the side.
Okay. How about now?
1 on this side, 2 on that side.
Okay. Now?
Switched. 1 on this side, 2 on the side.
Okay, very good. So, no double vision. That's great. Can you look here at my palm? And try to look up here at my fingers. Okay, same thing on here. Let's look. Okay, and up here. Okay, very good. So, there's no double vision. You do have vision deficiency on your right eye, but that's something that you are aware of, right?
Yes.
And you are already treating that. Other than that, no double vision, no. Your peripheral vision is intact. Pupils are in good shape. They're reactive to light, round and consensual, so that's great. Okay, I'm gonna be doing a hearing test. I'm gonna be making a vibrating sound with this tuning fork. Sounds like that. Okay. I'm gonna be placing this close to your ears. Let me know. I'll guide you through it. So, tell me when do you hear that?
Yes.
Tell me when it stops.
Stopped.
Okay. Can you do that one more time? Can you hear that? Tell me when it stops.
Stopped.
Okay. Can you hear this?
Yes.
Okay. Perfect. Can you hear that? Tell me when it stops. Try that one more time. Can you hear that?
Yes.
Tell me when it stops.
Stopped.
Can you hear it now?
No.
No. Do that one more time. Can you hear that?
Mm-hmm.
Tell me when it stops.
Stopped.
Can you hear this?
Yes.
Okay, perfect. Okay, so now let me know which option sounds louder. Does this sound louder or this one?
The second.
Okay. Does this sound louder or
The
this
second.
second?
Mhm.
Perfect. Do you hear these equally in both ears?
No.
Where do you hear it more?
On the right.
Okay. Try that again. How about now? How does that sound?
It's on my right ear.
Okay. Okay. Most hearing tests were good. There is a little bit more, your right ear is a little bit more receptive. But left ear is still picking up all the sounds, so that's good. Okay. So now we're gonna do a smell test. You can go ahead and close your eyes. You go ahead and cover your right nostril and take a deep breath. Exhale. Now let's do the same thing on the other ear. I just want to make sure they're not obstructed. Okay, perfect. Okay, can you go ahead and cover your right nostril again. Take a deep breath. Can you smell that? Can you recognize it?
It's orange.
Yep. Very good. Let's try the other nostril.
Lavender.
Yeah, perfect. Okay, now we're going to taste test. I'll be placing this substance on your tongue. I'll ask you if you can recognize the flavor. Okay, can you open your mouth?
It's cucumber.
Okay, very good. Okay, Nisa, I'm going to ask you to lay down on the bed facing down, and I'm going to do a very detailed examination of your scalp, make sure that there's nothing there. Your cranial nerves that control your face, your sensations, all your different senses, they're working perfectly fine. So I'll take a look to see if I find something else.
Okay, thank you.
Okay, so I'm going to be taking a look at your scalp here. I'm sure we don't find anything. I'm going to be parting your hair and taking a look at each section individually. Actually, I'm going to go ahead and put on my gloves first. Can you feel this?
Mm-hmm.
Okay, a tiny bit of dandruff. Do you feel this?
Mm-hmm.
Do you feel this?
No.
Do you feel this?
Yeah, I don't.
Okay. Do you feel this? About this?
Just slightly.
Slightly. Do you feel this?
Not very much.
Does this feel cold?
A little.
A little bit, okay. Do you feel this? Okay. How about this?
Just a little.
A little bit. This. Do you feel that?
Not really, no.
About this?
Slightly.
Slightly. Do you feel this?
No.
This? This?
Slightly.
Slightly. How about this?
Just a bit, yeah.
And this?
No.
No. Does this feel cold?
Yeah, a little bit.
Does this feel cold?
Yeah.
And this?
I don't feel anything.
Okay. Okay, there are no signs of eczema, no scaly patches, no lesions either. Do you feel this?
No.
This?
Yeah, a little.
Does this feel cold?
Mm.
This? No. Just making sure that I palpate and feel for any lumps, masses. Do you feel this?
Slightly.
Slightly. Do you feel it now?
Yes.
No.
Yeah.
Do you feel it now?
Not really.
No. Okay, so I'm definitely noticing loss of sensitivity, kind of like towards the base of your skull, where your skull meets the spine. So there could definitely be a nerve that is getting pinched on this area. I don't feel any inflammation, no swelling. But there definitely are no superficial dermatological reasons why you would be feeling numbness. Do you feel this vibration? Do you feel this? Okay. Do you feel this now? Yeah. Do you feel it now? How about now? Oh. Do you feel it now? Do you feel this now? No? No. Okay. So yeah, definitely use this part of the skull where it meets with the spine. I'm gonna try to do some therapy today. I'm trying to release the space between your skull and your scalp. Make sure that there's nothing there that is preventing the nerves. Making sure that there are no neurological damage here. Just trying to release any tension. This should feel just like a pulling sensation. It shouldn't really hurt, so if there's any pain, please let me know. I'm gonna go in and massage the area where we need some work. Hi, how are you?
I'm pretty good. How are you?
I'm good. I'm Nurse Ivy B, and I'm going to be doing a full head-to-toe assessment today. I know I see in your chart that the doctor wants to discharge you tomorrow, and I just want to make sure that everything's good before we let you go home, okay?
Okay.
Can you please go ahead and confirm your first and last name?
Madison Green.
Okay. And your date of birth?
July 3rd, 1996.
Okay, very good. Do you know what day of the week is today?
Today is a Saturday.
Saturday, very good. Okay. How would you rate your pain level today on a scale from 0 to 10, 10 being like the most painful thing you've experienced?
Probably like a 2.
A 2, so you're feeling a lot better. That's great. I also want to confirm a few questions that they missed when they did the intake paperwork. So, do you have any history of smoking tobacco, cigarettes? No. Do you vape?
No.
No. Do you drink alcohol?
Sometimes.
Sometimes. How many drinks per week would you say?
Like 2.
2. Okay, very good. Any recreational drugs?
No.
No. Okay. Do you exercise usually? How many times a week?
3 times a week.
What kind of activity do you do? Like high
Go
intensity?
jogging around the
Jogging,
neighborhood.
perfect. So 3 times. That's great. Okay. So now I'm gonna start by taking your vital signs. Okay. I'll be taking just gonna put this right here. Just leave this here for a second. I'll be putting this on your arm. Okay. Sorry. Good. Just gonna put this here. Okay. Place this right here. Can you go ahead? Oh, I thought your legs were crossed. You're good. Okay, so that's perfect. That was 100/70, which is very normal. So we have 100/70. take your temperature. This is gonna go inside the mouth, under the tongue. Okay. You lift the tongue right there. Would you hold it there for me? Nope. That's done. Okay, that's 99. Very good. I'll take this off here. Okay, and I'm going to be putting this on your finger. You can rest that. Okay, 100/70, 99 degrees Fahrenheit. Your oxygen is 97 at room air. And your heart rate is 83. So that's very normal. I know yesterday your blood pressure was a bit high, so it's definitely back to normal, which is very good. Okay. So next I'm just going to be taking a look at your overall appearance. Okay, you seem to be well rested. Did you have a good sleep last night?
Pretty good.
Pretty good.
A couple hours.
Very good. Your skin looks in good shape. I don't notice out of the just what I don't notice any inflammation, no redness. Okay, very good. Okay, I'm gonna be taking a look at your eyes. Okay. First, I'm going to take a look at your pupils. I want to make sure that they're dilating and constricted normally. They're reactive to light. That's very good. They're symmetrical as well. So that is very good. We're going to do a vision test. Can you go ahead and hold this with your right arm and then cover your left eye? How does that look? Can you see all the letters in here? Can you read this row for me?
LTFPH.
Okay, perfect. Can you go ahead and switch sides? Okay, can you read this row starting on your right?
HPFTL.
Okay, perfect. Do you know what color is this one?
Green.
And this one here?
Red.
Do you know what number is the last one?
9.
And the first one here?
2.
Okay, which circle is bigger, 9 or 2?
9.
Okay, perfect. Very good. I see that you're wearing contacts. When was the last time that you had a prescription?
Probably 6 months.
6 months, perfect. Okay, so you got contacts. Your vision is 20/20 with your contacts, so I think your prescription hasn't changed since, which is really good. Okay, I'm going to be taking a look at your optic nerve. You can just go ahead and look straight ahead. I'm going to get very close to your eye. Just try your best to, don't mind me. I'm just going to be here looking. I know it's a little bit uncomfortable. So your optic nerve looks intact. I do not notice any scratches on your retina. Your sclera is white. It's not irritated. The conjunctiva is light pink, which is very normal. No signs of infection there. Okay, that looks really good. Perfect. Now look at the other side. Okay, I'm going to be getting close to your eye. Okay. Again, your optic nerve looks intact. Do don't notice any scratches on the retina either. Sclera seems to be white, not irritated or inflamed. And conjunctiva light pink, no infection, no signs of jaundice either. Very good. Okay, so now I'm going to be palpating your face. I'm going to go ahead and put on my gloves for that. Okay, I'm going to be palpating around your eyes. You can go ahead and relax. Okay. Is there any pain as I'm palpating?
No.
No. Okay, very good. Okay, I'm going to be palpating your lymph nodes. Submandibular. Submental lymph nodes look good. Submandibular lymph nodes look good as well. Okay. Be palpating your preauricular lymph nodes. And they do not seem inflamed, and there's no pain. So that's great. And moving on to the post-auricular. No pain?
No.
Okay, very good. Palpate your sinuses. Is there any pain here?
No.
Okay, how about up here?
No.
Okay, I'm going to be touching the rest of your face, just feeling for any lumps or masses. Any inflammation. Okay. Okay, I'm gonna palpate your head as well, checking for symmetry. Okay. I do not feel any lumps or masses here either, which is really good. Okay, there's no pain or tenderness.
No.
Okay, very good. Okay. So I'm going to check your eye reflexes. Okay, what I want you to do is look at my fingers. I'm going to be moving them. And you can follow my fingers, but do not move your head. Okay? Okay, very good. I do not notice any movements out of the ordinary. Reflexes seem to be in perfect shape. Okay. Now I'm going to check your peripheral field of vision. So you can, again, look straight at my nose. I'm going to be moving my fingers into your field of vision and let me know when you start seeing them, okay? Do you see them right there?
That one?
That one. Okay, how about now? Do you see them?
No.
Okay.
Now.
Okay, very good.
Now.
Okay.
Now.
Okay.
Now.
Okay, perfect. Can you go ahead and cover your right eye? Okay, so now I'm going to be moving it outside of your field of vision. Just let me know again when you, so the other way around, when you don't see it anymore, okay?
Okay. No. No.
Okay.
No.
Okay.
No.
Very good.
No.
Okay, perfect. Let's go ahead and switch eyes.
No.
Okay.
No. No. No.
Okay.
No.
Perfect. That was very good. So eye reflexes are in perfect shape. Your vision is 20/20, so I'm not concerned at all in there. Do want to make sure that there's no double vision either. So would you look straight at my nose? Can you see my fingers?
Mm-hmm.
Okay. How many fingers am I holding up?
2, 1 on each.
One on each. Perfect. Okay. Can you see them now?
Mm-hmm.
How many fingers do I have up?
2 on each.
Okay, very good. So, no double vision either. So that's great. I'm gonna check your ears next, okay? Okay, Madison, I'm gonna be looking at your left ear first. Okay, so I'm just gonna get in here. You can go ahead and relax. Okay, I'm just looking at your ear. Okay. Okay, tympanic membrane looks pearl gray. There is a healthy amount of wax buildup, so no concerns there. The ear canal is not irritated or inflamed. There's no signs of infection. Okay, that's great. Take a look at the other side. Okay, you can go ahead and relax. You turn your head a little bit this way. Perfect. So I'm taking a look at your eye. Again, there's some healthy buildup of wax. Nothing concerning. Tympanic membrane is pearl gray. No signs of infection. The ear canal is very healthy. Okay, that's perfect. Okay, Madison, now I'm going to be doing a hearing test. Your ears seem to be in perfect shape, but I do want to make sure that you're perceiving sounds as you usually would, okay? So what I'm going to do, I'm going to be placing this tuning fork. It's going to make a vibrating sound, and I'm going to place it close to your ear. I'm going to give you 2 scenarios, A and B. Just let me know which one sounds louder, okay? I'm going to move your hair back here. Go ahead and close your eyes. Can you hear that?
Mm-hmm.
Can you hear that? Which one's louder?
The second one.
Second one, very good. Okay, can you hear that?
Mm-hmm.
And this?
Yeah.
Which one was louder?
B.
Okay, perfect. Now I'm going to be placing it on top of your head. I want to know if you can hear it equally on both sides. Can you hear that equally?
Mm-hmm.
Okay, very good. Okay, so I'm going to do this one more time. I'm going to be placing this right here. Just let me know when you stop hearing the sound, okay? Can you hear that?
Mm-hmm. No.
Can you hear that?
Yeah.
Okay, very good. Okay, can you hear that?
Mm-hmm. No.
Okay, can you hear that?
Mm-hmm.
Yeah, okay, very good. Okay, now you can go ahead and close your eyes. I'm going to make a sound close to your ears. Just let me know if you hear it on the right or the left.
Left. Right. Both.
let me know if this sounds closer or this. First one or second?
The first one was closer.
How about now? This one or this one?
Second one.
Okay, how about now?
Second.
Okay, perfect. That's really, really good. Okay, so now I'm going to be checking your mouth. I'm going to be checking for any mouth sores, any irritation. I think that would indicate nutrient deficiency or any other problem on some of your major organs. Okay. Go ahead and open your mouth. Okay. Mouth seems to be healthy. Soft tissue is in very good shape. Can you go ahead and lift your tongue? Okay, I do not see any inflammation. Gums look healthy. That's great. Okay, very good. I'm going to be checking your hair. I want to make sure there's no signs of parasites on your scalp. Okay. Okay, I'm gonna go in here with this brush to part your hair. Go ahead and relax. Okay. Okay, hair looks healthy. I do notice a little bit of dandruff on your skull, but that's normal, especially in this kind of weather. Do you ever get itchiness?
Not very often.
No? Okay. Sometimes it could get worse when you were working out. Okay. So yeah, definitely here there's very few scaly, dry patches. Do you have any history of eczema or psoriasis?
I've always had a little bit of dandruff.
Okay, yeah, for sure. I can recommend you a shampoo that's definitely gonna help. I'll write it down for you once we're done. Okay, I'm gonna look at the other side. Okay. Yeah, the side also has a little bit of dandruff, but go ahead and turn your head that way. Perfect. Okay. Yeah, the irritation seems to be mostly on the top of your head. Okay, that looks good. Other than that little bit of dandruff we found, there's no other concerns here. Okay, try to put your hair back. Okay, perfect. Okay, can you go ahead and grab my hands? Can you squeeze them as hard as you can? Very good. Now go ahead and extend your arms. You move your wrists up and down. Very good. I'm gonna try to push your arms down, so just resist. Okay, same thing. I'm gonna pull up. Okay, now you go ahead and try to push my hands down. Okay, and up. Okay, very good. Your muscle tone seems to be perfect. I'm going to be checking your reflexes and also your strength on your feet as well. Okay, I'm going to go ahead and... Okay, very good. Okay, your reflexes seem to be very normal. Okay, perfect. It's very good. You go ahead and push my hands. Okay, very good. Now try to pull with your feet. Very good. You try to spread your toes. Very good. Now leave them spread out, and I'm going to try to... Okay, perfect. Very good muscle tone. Your strength is all right there. Okay, very good. Can you go ahead and lay down on the bed for me? Okay, I'm just going to be making some notes of my findings here. Patient seems to be very alert and awake. Not lethargic or confused at all. Your eyes were in perfect shape. Vision 20/20. Pupils were reactive to light. And round and equal on both sides. Hearing test was perfect. Your extremities seem to be very strong with good muscle tone. Okay, no lumps or masses on your face or your head. Okay, very good. Okay, so I'm going to take a listen at your heart. Do you mind if I put this underneath the...
Yeah, it's fine.
Okay. Okay, Swannon is 2. Now it's 3. Now it's 4. No signs of murmurs. Okay, that's very good. Okay, now I'm going to be listening to your lungs. You can go ahead and take a deep breath. Exhale. 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 Okay. Would you go ahead and rotate a little bit on your side? That way so I can listen to your back. Okay. Perfect. Can you go ahead and take a deep breath? Exhale. Take a deep breath. Exhale. Take a deep breath. Exhale. Take a deep breath. Exhale. Okay, that's perfect. So your lungs sound clear. There's no wheezing. No extra sounds in there, so that's perfect. Okay. Okay, so now I'm going to be checking your extremities for any signs of edema. I'm going to be looking at the skin, so you can just go ahead and relax. Okay, so taking a look at your arm, your left arm first. I'll be taking a look with my pen light, just to make sure that everything looks good. Okay, the nails seem healthy. There are no signs of clubbing. That's perfect. Okay. There's no signs of edema. Just gonna do a little bit of a pinching test, making sure. Okay, yeah, definitely no signs of edema. Okay, no inflammation. Capillary refill. It's less than 3 seconds. Okay, very good. Your skin looks normal. I do not notice any major scars. There's definitely no inflammation. No moles that would be concerning. There's a tiny bit of irritation on this side. Does this hurt at all?
No.
Okay, very good. You can go ahead and rest your arm. Okay, I'm gonna look at your other hand. Okay, taking a look at your other hand here. Again, the nails look very healthy. No signs of clubbing. Just double checking your capillary refill. Yeah, definitely less than 3 seconds, which is normal. Okay. Again, no signs of edema here either, which is very good. Now just taking a look at the rest of your arm. No inflammation. Skin looks healthy, hydrated. I know hospitals can sometimes be very dry, but you're definitely staying hydrated, which is a very good sign. There's no pain as I'm palpating.
Nope.
Okay. Okay, that's perfect. So I'm gonna go ahead and check your legs as well. Okay, so I'm checking here for any signs of edema. Your feet look in very good shape as well. I do not notice any inflammation. I'm gonna be doing your Babinski reflex. So this might feel a little bit sharp or a little bit ticklish. Okay, very good. Okay, perfect. Can you go ahead and pull my hands with your feet? Very good. Can I go ahead and push on them? Perfect. I'm gonna go ahead and take your pedal pulses. definitely they're symmetrical, which is great. Okay. Now, looking again at your skin on your legs, making sure there's no signs of lesions on the skin. I do notice you have a scar in here. Do you know what happened?
It was an iron. An iron was left on.
Oh. Okay, but it seems like it has healed properly. Was that a long time ago?
A couple months, yeah.
Okay. Okay. Is there any pain as I'm palpating?
Nope.
Okay, I do not feel any tender spots. Do want to make sure there are no signs of thrombosis. Your calves seem to be soft and normal. Is there any pain as I'm pressing here? Okay, let's try this side. Any pain? Okay, that's perfect. Okay, very good. Okay, I do want to make sure that your perception of sensitivity or sensations on your legs is normal. I'm going to be touching you with one of two objects. This one is going to feel soft. Do you feel that? Mm-hmm. And this one's going to feel sharp. Do you feel that? Okay, you can go ahead and close your eyes and just let me know what you feel, okay? Sharp. Sharp.
Sharp.
Very good.
Sharp. Soft. Soft.
Okay.
Sharp. Sharp. Soft. Soft. Sharp. 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 Soft. Sharp.
Okay, very good. I'm going to introduce another object as well. This should feel a little bit cold. Do you feel that? Okay. How does that feel?
Cold.
About now?
Sharp. Soft. Soft. Sharp. Cold. 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 Soft. Sharp. Sharp. Cold.
Okay, very good. So now we're going to do a similar taste on your face as well. Okay, so I'm going to be using cotton swab. I'll be touching your face again. This is going to be soft or dull, and this feels sharp. Okay? Do you feel that?
Sharp. Soft. Soft. Sharp. 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 Soft. Soft. Sharp. 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 Soft.
Okay, very good. You go ahead and tell me what side of your face you feel this.
Left.
Okay, very good.
Right. Bottom.
right. Bottom left.
Okay.
Bottom right.
Okay, perfect. Can you go ahead and open your eyes and give me a big smile? Okay, very good. I'm just assessing the muscle mobility and muscle tone on your face. Can you go ahead and frown for me? Okay, very good. Now go ahead and stick your tongue out. Move it from one side to the other. That's perfect. Okay, very, very good. So I do have a couple more tests that I want to do to make sure that your cranial nerves are intact as well. Okay, can you go ahead and cover your right nostril for me? Can you smell this? Mm-hmm. What does it smell like? Can you recognize that?
Sort of floral.
Okay. Lavender.
Lavender, okay.
Okay, can you go ahead and cover your other nostril? Can you smell that?
Mm-hmm.
What does it smell like?
Citrus.
Okay, perfect. And now you can just uncover your nostrils. Can you smell that?
Yeah.
What's that smell like?
Peppermint.
Very good. And I also want to make sure that your taste is being perceived properly by your brain. So I'm going to give you a couple of substances to taste. Just let me know if there's, if you can recognize it. Okay, you can go ahead and close your eyes. You will stick your tongue out. I'm just going to place this on your tongue.
I don't really taste much.
Okay, let's try again.
Like lemon?
Let's try one more. Make sure. Let's see if you can recognize this one. Okay, go ahead and open your mouth. Does that taste like something?
Tastes sour.
Okay. Yeah, so this one's lemon.
Okay.
Okay, very good. The other one was orange, so pretty close.
Gotcha.
Okay, so now I'm just going to take a look at your abdomen. I want to make sure there's no tenderness or issues on any of your major organs. Okay, I'm going to be covering you with the bed sheet. Just want to make sure there's normal sounds. Okay. So definitely your stomach sounds normal. I'm gonna be palpating a little bit. Let me know if there's any pain. I'm just looking for any signs of tenderness. Is there any pain or discomfort there?
No.
No. Okay, very good. Okay. Everything seems normal. I do not notice any inflammation. gonna be tapping lightly. Let me know if there's any pain. Just making sure that your organs sound normal. Okay, very good. So no pain, no tenderness. Abdomen is soft. Just normal. And I'm just going to take a quick look at your skin. Notice a couple of moles, but seem to be normal in color, size, and shape. They are not raised from the skin. Uniform edges are very smooth. No darker spots or signs of lesions or irritation. Belly button seems to be normal too. No signs of infection there. Is there any pain here? Okay, so definitely that's normal, not red or irritated, not inflamed or any pain. Okay, very good. Okay, you can go ahead and cover the abdomen. Okay, Madison, so I'm done with my examinations. I'm just gonna make a few notes on your chart. Your heart is normal. There were no signs of murmurs. The heart rhythm was regular, so that was very good. Okay. Your lungs sound clear, no sounds of wheezing or crackling, so none of that. Definitely the infection seems to be clearing up. Your lymph nodes were not inflamed, which that's a great sign. Abdomen is normal. We auscultated and palpated and everything seemed to be normal there. It was soft, no signs of tenderness. Normal bowel sounds, so that's great. So yeah, I'm gonna send this to the doctor, and I think the doctor should be here. He's usually doing his rounds around 9 a.m.
Okay.
So he should be here in the morning, and then seems like everything's good. So I think he will be discharging you tomorrow.
That's
Okay?
great.
Okay. Do you have any questions for me?
No.
No? Okay, very good. If you need anything, you can definitely press the call button, and I or any of the other nurses will be right in.
Okay. Thank you.
Okay. Have a nice day.
Thank you.